My name is Jenna Marcus, and I am Assistant Professor of Gynecologic Oncology at Northwestern Medicine. My focus, in addition to caring for patients with gynecologic malignancies, is also a focus in patients who have a predisposition to cancer, precancerous conditions, as well as strategies to reduce any toxicity from treatment while patients are going through adjuvant treatment for cancer. Cancer predisposition is passed on through genetics by means of family members. Typically, when patients have cancer, they develop cancer in one of two ways. It's either spontaneous and sporadic. It can be caused by something in the environment, a toxin, for instance, or a virus, like HPV and cervical cancer, or it can be passed down in families. The field of gynecologic oncology, there are certain types of cancers that are more likely to be passed down in families or inherited. Those cancers are commonly ovarian cancer, uterine cancer, endometrial cancer, and we see that come along with certain familial conditions like hereditary breast and ovarian cancer and Lynch syndrome-associated cancers. Even though they are more likely, it is still more common to develop these cancers sporadically. Anywhere from about 2 to 3% in uterine cancers and up to 20 to 25% of ovarian cancers are inherited. We use different technologies when screening for predisposition based on the mode of obtaining a patient sample. We can get saliva or blood from a patient. This is something that can be done even at the patient's office visit so that we can test them for predisposition. I see the screening for genetic predisposition to cancer evolving in the future to really be certain that we are catching all of the patients who are at risk. Patients who have family histories, but they themselves may not have had a cancer diagnosis, is important to offer them testing so that we can consider risk-reducing strategies for patients developing certain types of cancer. So in patients who have a risk or a familial risk of an endometrial cancer, typically we offer these patients things like endometrial biopsies. They'll also be sent to other clinics for screening of additional high risk to other specific types of cancer like colon cancer in Lynch syndrome patients. In our ovarian cancer patients who carry one of the high-risk gene mutations, the most common genes that I think everybody's familiar with are the BRCA1 and 2 genes. Those patients we can offer risk-reducing surgery to once they've completed their families. If they haven't completed their families, we also can discuss with them chemical prophylaxis or medical ways that they can try to reduce their risk, in addition to offering them screening with blood tests, ultrasounds, and regular examinations with their physician.